What surprising risk factors lead to bladder cancer? You might think that smoking is the only major risk for bladder cancer, but there are some less obvious factors that can also play a role. For example, certain jobs expose people to chemicals that can increase the risk. Workers in industries like dye manufacturing, rubber, leather, textiles, and even firefighting often handle substances like aromatic amines, polycyclic aromatic hydrocarbons, and benzene. These chemicals are linked to a higher chance of developing bladder cancer. Studies show that up to 20% of bladder cancer cases may be related to occupational exposures. Recurrent urinary tract infections are another surprising factor. If someone has frequent or chronic infections, especially women, the ongoing inflammation can irritate the bladder lining. Over time, this irritation might promote changes in the cells that lead to cancer. While UTIs are common and usually not serious, persistent infections should be taken seriously and treated promptly to help protect bladder health. Hormonal factors also seem to influence risk, especially in women. After menopause, estrogen levels drop, which might reduce the protective effects estrogen has on the bladder lining. This change could make the bladder more vulnerable to harmful substances like those in tobacco smoke. Although research is still ongoing, it suggests that hormonal shifts could be part of the puzzle in understanding bladder cancer risk in women. Emerging evidence points to opium use as a risk factor too. Studies indicate that people who use opium may have nearly 3 times the risk of developing bladder cancer compared to non-users. This is a newer area of research, but it highlights how substances beyond tobacco can influence bladder health. Infections with the parasite Schistosoma haematobium are a well-established risk factor, especially in tropical regions. This parasite causes chronic inflammation and damage to the bladder wall, which can lead to cancer over time. People living in areas where this parasite is common should be aware of this risk and seek medical advice if they suspect exposure. Environmental exposures are also being studied. For instance, exposure to diesel exhaust, which contains carcinogenic compounds, has been linked to bladder cancer. Firefighters and others exposed to toxic fumes during their work may face increased risks, though research is ongoing to fully understand these connections. Recent studies suggest that the balance of bacteria in the bladder, known as the microbiome, could influence cancer risk. While this area is still new and not fully understood, it points to the importance of maintaining a healthy urinary environment. To help protect your bladder, avoiding tobacco remains the most effective step. If you work in an industry with chemical exposures, using protective gear can make a difference. Managing urinary infections promptly can also reduce chronic inflammation. If you have known risk factors, discussing screening options with your healthcare provider is a good idea. Remember, bladder cancer can recur, so ongoing medical follow-up is important for survivors. Understanding these surprising risk factors shows how complex bladder cancer development can be, involving lifestyle, environment, infections, and biological factors. Taking steps to minimize exposure and stay vigilant about bladder health can make a real difference. Always consult your healthcare professional for personalized advice and screening options.